had been involved in a motor scooter accident last November that I didn't receive medical treatment for because I didn't have health insurance. And was on crutches for 6 weeks, was out of work for 3 months, and then started working again in this February. But was still in a lot of pain. There's still a lot of swelling in my knee. And waiting tables, of course, so it was pretty physically demanding. And I started noticing my other knee swelling and becoming painful. And I just was in a lot of pain. My feet hurt, my knees hurt, my hips hurt, my back hurt. And my boss has seen Dr. Lay, I think, for a few years, and she wholeheartedly recommended her to me. And so after a couple of weeks of putting it off longer, I just couldn't take it anymore, so I called her up. I came to see Dr. Lay for the first time. She spent, I guess, probably, it seemed like a long time, probably at least an hour with me. Doing different tests, seeing how strong I was, how my circulation was, things like that, and gave me, the next time I came to see her, she gave me kind of a little course of action she thought we should take for working, not even specifically on my knee, but my whole body, kind of from bottom to top. Since then, I've been seeing her twice a week, and I can't even remember how much pain I was in sometimes, except I actually looked at my journal from right before I started seeing her. And it was like all about how my joints hurt, my feet hurt, my back hurt. I was just achy everywhere. And so, yeah, it's been subtle, but it's like a complete kind of transformation. My boss who referred me to Dr. Lay told me that she wasn't like a regular chiropractor, which I welcomed because I became frustrated with the previous chiropractic care that I had, because after the first visit where my chiropractor took an intake and spent a lot of time with me, after that, it was like she had an office with 2 rooms. She had 2 people going at the same time all the time, so she was just going back and forth from room to room. And it just felt like she was in a rush. She wasn't focused on me, and she would listen to what I said, really hear like my number one complaint or what the number one symptom was that I was experiencing, and do an adjustment kind of according to that, which would temporarily alleviate the acute kind of pain and experience that I was having. But, I would be right back to see her like a month or 2 later, and it was just the same thing over and over, and this pretty much the same adjustment. So when I first started coming to Dr. Lay, she, for the first couple of visits, she really focused on my left foot, which was interesting to say the least, but it really started alleviating the pain that I had in my foot and helping me to support the knee that I had injured in my accident. And then as I've been going for longer, she kind of has worked her way up my leg. And after, I think, about a month and a half, she did my first spinal adjustment. But that was, 6 weeks of twice a week work, really kind of focusing on my feet, my ankles, and my legs, and getting my back, I think, ready for that kind of an adjustment. Different from my experience with other chiropractors. We spent on the intake, and actually in successive visits, we've spent time talking about kind of how I'm doing in my life, where I am emotionally, and how the things that are happening in my life are affecting me physically, and how my body is responding to those things that are happening in my life. How, I may tense up in certain places when I'm experiencing stress, or basically things like that. And kind of working through that in treatments, actually, like working on the areas where I feel like I'm getting tight in my regular life, in outside of the office, and kind of talking through them while they're being worked on physically. So it's a balance of kind of emotional work and physical. I do recall specifically one visit where she began by working on my shoulder and my arm around this joint, and was saying how it seemed like I was holding something and felt like I wasn't maybe expressing myself, or being able to express myself in certain conflict situations, and asked me to talk about what I was thinking at the time while she was rubbing my shoulder. And I was telling her about a situation with my housemate, which was a small kind of interaction that kind of brought up some issues with me about boundaries. And as I was talking to her about boundaries, maintaining boundaries, and being upset with my housemate, she really started working, I think, deeper into my shoulder and more around my arm, and I felt a loosening and an emotional loosening at the same time. It was a kind of a release in both ways. That was almost one of those kind of interactions that at the time doesn't seem that important, but you realize it's kind of needling you. It's something that it's like kind of a little sand in an oyster, just kind of sitting there and irritating you. And one of those things that I have a tendency to allow to build up. And so it was interesting to realize that something that small had affected me on that kind of a scale. But I have had other instances of more heavy emotional engagement, for sure, in kind of actually in areas that we're starting to get more into now, I think, in my treatment, in my lower back. Talking about family and parents and more intimate relationships. Well, I think really even more specifically was that in addition to the physical symptoms that I was experiencing when I first started seeing Dr. Lay, which were the, ligament damage in my knee and the foot pain and the back pain and all of that, was that I was also really depressed. I don't have clinical depression or anything like that. It's not an ongoing thing, but I was having a deep, episodic depression at the time. Partially because of the injuries and the accident and being unemployed, but also things in my personal life and relationship issues that were happening. And before I started seeing Dr. Lay, I was like, should I see a psychotherapist or should I treat my physical symptoms first? Because they were kind of in competition with each other for what I could give attention to, financially and emotionally and all that. So really, I think I was in so much pain that I decided I had to alleviate the pain. I had to get on that first thing and then deal with the emotional aspects of it after, not knowing that coming here and seeing Dr. Lay was actually going to be the best of both worlds. That not only has my pain been alleviated, and not in a quick fix kind of I adjusted you and you're free from pain and we don't have to see each other for a long time, but that I came in, I was treated with compassion and sympathy and expertise with my physical body, but also really with an open ear, someone who's willing to hear about my pain and do something about it physically, but also kind of help me reflect on how my pain and my emotional pain and my physical pain were connected, and how I could kind of work my way through and out of both of them simultaneously.